happy to have your questions.
Kenny, you've criticized Jay Nixon's proposal as being too expensive and unsustainable. House Republicans during the legislative session said the same thing about the Insure Missouri proposal. How much does your plan cost, and is it sustainable?
Well, it is sustainable. And let me try to answer your question. First of all, this is not the government supplying health care. This is the private sector. And so Health Max is actually, dare I say, it's a legal framework. It's not even a, I don't want to say bureaucracy, but it is a legal framework that will administer these private plans. Now, yes, for those that are, I hate to use the term, it's not working poor, it is those that are who are in the workforce here in our state but who do not qualify for Medicaid. For that group, yes, the state will in fact subsidize their health savings account premiums. The best estimate we have, and this is a ballpark figure, would be somewhere in the neighborhood of $50 million. One of the things we do, you okay? All right.
Is that $50 million just for the subsidy of those unemployed folks or
yes,
lower income
well,
folks?
they're working folks, but are those that just are above the Medicaid eligibility lines here in our state. And so again, part of this, Tony, will depend on, for instance, the health savings account in another state may say we're going to have a catastrophic coverage and a high deductible. I mean, part of this is, I think census numbers coming out today, in fact, Ed, as far as the census numbers are coming out right now, for instance, on uninsured, and I'm not going to do anything to put our state budget in jeopardy, but the ballpark figure for the plan that we're contemplating on the subsidy itself would be around $50 million.
Would it cost something additional for the state to administer it, to act as the, I guess you have to have some state oversight, right?
There would be some state oversight, and quite frankly, David, I think it would be a minimal cost. I mean, it's a couple of $1 million perhaps. And again, this is on the outside edge, but the idea of it is to provide the framework that it actually would be the savings themselves. And I actually think that, and some experts disagree, and so we'll have this discussion and debate, but part of the savings for this, the cost of this, could actually be found within more efficiencies in Missouri Health Net. But we're not counting on that as far as what, as far as the cost itself. I think we can find more efficiencies, for instance, in Missouri Health Net, but this is not a bureaucracy. We're not creating a bureaucracy. We're creating a framework then which would administer. So there would be some administrative cost.
So when people purchase a plan through Health Max, will they be purchasing an individual insurance plan, or will they be buying into some group plan?
No, well, it depends. I mean, again, we will invite those in the private sector that come into Health Max and offer a plan, but here are the requirements, and part of the requirements are you cannot discriminate against anyone with a pre-existing condition. And so if you want to, and the insurance company probably would say, we're unwilling to do that because of this whole issue of adverse selection. And the response then back to the private sector is, but we are changing the risk pool from an exclusionary risk pool, which is what current law and what Insure Missouri was, to an inclusionary risk pool. And so now we have those of us that are 50 whose knees hurt when they run a 5K, and we include those of us falling apart with the 23-year-olds who can run a 10K and who are healthy. Suddenly you are spreading the risk in a larger number of people. Because as we have, as Tony's question, as we put people or provide the subsidies as far as the health savings accounts, we're going to expand the number as much as 200,000 people that would be added into the risk pool, and then to add to that the state employees, the consolidated health plan. Each year they have to sign up. One of the things, again, we would roll them into the risk pool unless they choose to opt out, and certainly they're welcome to opt out. One of the challenges is, how do we communicate to the population that doesn't have health insurance? And again, we've looked at a number of ideas, and again, another state, Massachusetts, says a mandate, that you have to have a mandate. People have to provide some minimum coverage for themselves or their families. We don't say that at all. But there is an education challenge that we have, and one of the ideas we had would be, as people renew their driver's licenses each year, to give them at least the information on how they can access health insurance through Health Max. A significant reason why people have health insurance. So we're saying you cannot discriminate, but here's what we're going to do to lower the risk that you have is that we no longer are going to require these exclusionary risk pools, but we're going to have a much larger risk pool, which is the incentive then for the private sector to participate. In addition, let me say this too, we want to give an incentive to the individuals. And so, for instance, one of the features of the health savings account would be there would be a $500 preventive care or wellness piece that would have to be spent for regular doctor visits, for instance. If at the end of the year, and the way that we encourage then that person who gets the health savings account to really manage their health account most efficiently, if at the end of the year, and you've been healthy that year, they can either roll over that additional money into the next year's health savings account, or they could cash it out and put the money in their pockets. And so there is an incentive there for them to be healthy. And then we provide some ideas and incentives, Jason, for businesses or employees themselves, as far as, you know, these are pre-tax dollars going into these vehicles, and so some tax incentives here I think would also see the number of people that actually purchasing insurance would go up.
So Kenny, the majority of people go through their employer to get their health insurance. Now with Health Max, can I just go out and buy a plan myself, or are you still going to have to kind of go through your employer?
Up to you. It'll be completely up to you. Now here's the thing, you know, I don't know what sort of health plan is offered at KFRU, for instance. But let's say that there is a group plan. It could be that Cumulus Broadcasting would choose that, at least here in the state of Missouri, for those of you who work for Missouri-based stations, that they would roll their health insurer, maybe their health insurer would want to participate in Health Max in the state of Missouri. But ultimately, you're going to be a better consumer of health care as far as looking at, you know, I can stay on my current plan that my employer offers, or you know what, you know, I'm still young, you know, I've had a pretty healthy couple of years. I think I'm going to get out of the Cumulus Broadcasting plan, and I may want to have my own plan for me or for my family. Again, the choice is up to you, but I really believe that this competitive model is going to keep costs down and is going to provide a number of choices. And so then you yourself would make the determination as an employee of Cumulus whether you wanted to stay with that business plan offered to by your employer, or choose to go on your own. And the employer itself may want to have its health plan, the insurers participate in health.